right, welcome everyone. Yes, we are here on our STEMsation Spotlight talk show on this wonderful Sunday afternoon, well, evening pretty much. I have two amazing guests, but before I get to them, I'd like to tell you guys a little bit about myself. If you haven't been watching, I am Nikisha Washington, the CEO and founder of Nyla Enterprises, where we instill and encourage girls to be confident, have good character in class as they become future leaders. But we're a little bit biased. We want them to become future STEM leaders. And so we do this by offering educational resources. So if you have not been watching or you're new to us, I just want to say we do have some things. And let me see, get this so where you guys can see it for a second. I offer some Nyla Nova books, which are educational tools for preschoolers to first graders, where they can read about how they can find their inner science superhero, or they can do activity books. So if you have not been following us, please check out Nyla Nova on nyladene.com. But we'll come back to that. We are here because we have two amazing guests, and you guys are in for a treat. And so I just want to say we are interactive. So if you are watching, please say hi. I see some people already saying hi. Please ask questions. We want this to be as interactive as possible. So as we get started, I'm going to acknowledge some people that are saying hi before we can get started. We have a Bright Buffo. I think that's how you say his name. He said, hey, a CL Lee. And a Bronte says hello. So I want to say hello, welcome, thank you. Thank you. So we're at this time where we get to introduce our guests, and I love for them to introduce themselves because they have such a rich background in history that they're going to introduce themselves and they're going to tell you a little bit about their inspiration of what led them on this journey. So our first question is, who are you? And so we're going to start with Dr. Lawrencia. I learned to pronounce it, Dr. Lawrencia, and then we're going to go to Rudi. Yes, hello. So, Dr. Lawrencia, please grace us with who you are and tell us a bit about your background and your journey here.
Okay. Thanks, Nikita, for this opportunity. So my name is Lawrencia Azaz. I come from Ghana, okay, and I have been a medical doctor for the past 5 years. I graduated from medical school in 2014 in Ghana. So I worked in Ghana for the past 5 years, and then I decided I wanted to, advance my career. I wanted to do more to improve health, not only in my country, but worldwide as well. And so I came to London. I applied to my dream school, which was London School of Hygiene and Tropical Medicine, to do public health. So I'm currently here pursuing a master's degree in public health. I started last year, September, and I'm due to finish in September this year. So that's a little bit about me.
Wow. So being a doctor was not enough. She's going back for her master's and everything. She's moved to London. Oh my God. But I am so happy to have you here. I just think that your story will definitely encourage and inspire the next generation and make sure that even women of any age to follow their dreams and their passions. So if you guys are joining us, I have added her article link. So if you have not read Dr. Lawrencia's article, please read it. I have it here, and please share this out. Please share this link out to everyone. Start watch parties so everybody can watch us, because the more eyes we have, the more people get to see us and hear us spread our word. So welcome again, Dr. Lawrencia. And now we're moving on to Rudi. Yes, Rudi, tell us a little bit about yourself and what you're doing.
That's a hard introduction to follow.
Oh no, you're great. Everybody has
I'm very jealous. But yeah, so I'm Rudi. I'm from Atlanta, Georgia. I am a dual incoming PharmD and PhD student, so doctorate of pharmacy and master's of public health. I got my bachelor's in public health with a minor in chemistry at Southern in 2018. And then I took a gap year because my mind was just over it. So I spent my gap year in the emergency room, and now I'm a pharmacy intern, about to get my white coat in exactly 1 week. So I'm so excited. I'm so excited.
We're excited for you.
Right there.
That's wonderful. Wow.
That is awesome.
Yeah.
Also, I have added Rudi's link as well, and I did a little quote that she and Dr. Lawrencia said. So please, guys, make sure you go after this and read her article, read their article if you have not, and share. We had some people say hello, and of course, I'm going to butcher all these names. I'm so sorry. So it says, "Hi, Queens in the house." I think it's Atiba Nelson. I'm sorry for butchering these names. And then is it Onyango? Hope you enjoyed the show and learned from these trailblazers. Yes. Then Comfort, I can say this is Laurencia's mom. She said hi. Bronte, I see you, Dr. Lawrencia. Yes, there seems to be a problem with the network or something. The stream keeps breaking off. Oh, I hope it doesn't break off. Oh, well. This just reminds me, someone said hi, Trailblazers. And so you guys may be out there wondering, what is a STEMsation? And usually I say that, but I forgot to say it this time. But a STEMsation is a trailblazer in the fields of science, technology, engineering, and math that are skyrocketing to their highest potential.
It's just a baby. I cried and I was like, maybe this isn't my path. What if it is my path? What if I have to take a gap year? So luckily I still had another year of college. And so that year of college, I basically made it my goal to be like, find out what you want to do, find out your passion, and not necessarily what you think you want to do. Like, find your true passion. So I had already fallen in love with my public health major. I knew I wanted to educate people, not just treat them. Sort of what Dr. Lawrencia said. I wanted to educate people. I wanted to help them. I wanted to better their lives. And so it was my last semester of my public health courses, and I took an advocacy class. And at the same time, I was taking biochem, which is a lot of drugs and stuff like that and mechanisms. And my advocacy public health class mentioned pharmacy and how we educate people and how they're really easily obtainable versus trying to get to your PCP sometimes. Like some people go to their pharmacist and they're like, hey, I just have this one question about my medicine. And so I started thinking more and more and more. And at the time, I still only knew retail. And I was like, I kind of want more. I want more from retail. And so I started researching and I found there's like emergency medicine pharmacy, there's transplant, there's oncology. And I just felt so in love. And especially with the aspects of pharmacy where I'm not only just prescribing or treating, I'm also educating these people about the importance of compliance and managing chronic diseases, making sure their medicines are not counteracting. So I fell in love and I've been gung-ho since. And I'm so excited because like, obviously I was like, okay, I want to do both. And so it was just like literally just God's plan. Because like the first school I looked up had a dual PharmD MPH program. I applied to, and then I got in and I was like, okay, this is obviously my path because dentistry, I thought I was gung-ho. I thought it was it. And God was like, nah.
No, and I love that you were able to say that because we were sometimes we'd be so stuck in, I'm going to do this path. And God's like, no, how about this? And you're like, no, but you know, you don't know why sometimes they say sometimes it's closed door. It's a blessing and we don't realize that at times.
Yes.
I'm hoping our audience, they keep saying the stream is cutting off. So I was checking it and I know when you were talking, Rudi, it was going in and out a little bit. But now I can see everybody clearly. So I'm hoping it's better. So guys, if you're out there, you can see us and it's getting better. Please let us know. My mom always watches. If I don't have anybody else, she always watches. She says hello. So we have some more people. And like I said, I'm going to butcher these names. I'm so sorry. There's a Minx Asamoah. I don't know. She says the stream keeps cutting off. You know, Saibe says hello. These are all your folks, Dr. Lawrencia. And I'm like, I can't pronounce these names, but thank you guys.
I know. My Ghanaian family.
They're saying it's better now. I'm glad it's better. I'm so sorry. It's, you know, with all this, I am so sorry. But I'm glad it's better. So we're going to move on. But I love you guys' story because, like you say, it's a journey. And I want people to understand that. And in your journey, you might change what direction you're going into. And it's okay.
Yes,
it's okay.
it
It's okay. You might be like me, 43, and be like, well, I want to do this now. And it's still okay. We got to stop being in that old mindset where you pick something, you got to stick with it. And you're going to do it till you retire. When there's so much more fulfillment out there in the process. And that's what I'm learning, just to love the process, because sometimes we get to the end and then we be like, this is it.
Yeah.
You know, like understand each step helps us appreciate what we've gone through, and then we look back and be like, man, I made it, I did that. So I love it.
Yes.
So what do you like most about your career? Dr. Lawrencia, we're going to start with you. What do you like most about your career?
Well, I don't know if there's any other profession that, you know, where you get to save people's lives. So I think that's probably the coolest thing about my profession. But, you know, just the fact that, you know, I get to interact with people, get to help people feel better, and then sometimes also save their lives. I mean, it's just so rewarding. Like, it's one of the most rewarding things I think anybody can experience. And the fact that I get to do that as a job, I feel really like blessed and honored to do that. So I think that's probably the best thing.
Yes, when you put it like that, saving people's lives, yes, I definitely agree. I mean, like, you really do that, and that is awesome. So I applaud you. I applaud both of you because you're both into medicine, and usually we don't get that. We usually get someone in medicine and an engineer, but to have both of you in medicine, and like, you are saving people's lives, and we thank you, and we need you guys, and we need more of us. So because we have read statistics after statistics where that some people don't know how to treat us because they don't know our background and our history. They don't know what we're more susceptible to or our lifestyle. But if you got more doctors and PharmDs and all those in there, they can look at us and help and save us. So I'm glad you guys are there fighting on the forefront. So thank you, thank you, thank you. Yes, yes. All right, Rudi, why did you, what do you like most about your career? I'm sorry, I was going backwards. What do you like most about your career and the career that you're going into? Because I know you still got a little bit of more time, but the career you're going into, what do you like most about it?
So far, I really like how appreciative people are. So currently in my internship, I am in a retail pharmacy because I can't really get into the hospital just yet without officially becoming a student. But I love how appreciative people are. Like when you ring someone up and you're like, hey, this is $1,000 something, you know, how about we try GoodRx? How about we try this? We sign up for this plan. And, you know, that price goes from $1,500 to like $120. And, you know, they're crying and they're like, thank you so much. You have no idea how like important this medicine was and how much I've been thinking about it all week. So I love that part. And when people are just like, thank you so much. Like, you answered my question. I've been trying to reach someone for days at my doctor's office in regards to this, and you just really helped me. And then even consultations, when people come in, they're like, I just have a question, like, what can I take with this, like with my current medications? Will this mess me up? And, you know, you just sit them down and you're like, hey, we can do this. We got it. Yeah. Like, this is what we do. We're like, we know what counteracts with each other and drug interactions. Like, we got you. So just like seeing them, people, you know, they come in, they're so wound up and they're just like, oh, thank you so much. Like, that is just like one of the best feelings ever. Cause like, yeah, we have people scream at us all the time and we don't take it personally, but when someone's like, thank you, like from the bottom of my heart, you know, my mom's been in the hospital for several weeks and you just really, really like helped her out. And so that's like awesome. Like, you know, you say, oh, no problem. And you turn around and you're like, yes. So, it's great. It's very fulfilling so far. Of course, it was a bad days, but those moments are like priceless.
I bet. And I was just thinking that when you were talking, it's a shame. And I know even Dr. Renston, you see this, where people have to like, and I know here in the United States that, like you said, $1,000. If someone has to pay $1,000 for medicine, how they're expected to live? Like, that is rent payment. Exactly. You know, and that's what I think with medicine, especially here in the United States. It's like we have to come up with a better way. And I know we have all these people that are running for office and they're talking about, you know, different things, but that's a real chore for people, because if I have to pay $1,000 for some medicine that I need every month, how am I going to pay for my living expenses and work a regular job. Like, that's unheard of. So I am glad that you are there to help them find a discount or something that can help them, because $1,000, oh my God, I will go crazy. I will have to just need the medicine. And then I've seen articles where people have died because it's between medicine or living in a house or, apartment or something, or rent. They have to choose, and it's sad when we have to choose. I don't know, Dr. Lawrencia, about you being in London and been in Ghana. How is the medicine, the prescription, like, how is that over there? Is it more affordable, or are they still running into some of the same situations that we're running into, where it's just astronomically too high?
Oh, I think, you know what, with medicine, right? I'm just talking about like healthcare in general. I think this cuts across in lots of countries. Healthcare is expensive. It really is expensive in most countries. In Ghana, Ghana is not an exception. London is not. And that's why sometimes, health insurance is important. And the type of insurance that a country, uses is also very important. Like, for instance, in Ghana, we have like the national health insurance, and these these kinds of policies are introduced to help, prevent exactly what you were, describing. In technical terms, we call that like catastrophic spending, where people spend money on healthcare at the expense of, other things they could use that money for. Like they sacrifice on what they're going to eat, other things, so they can actually spend on healthcare. So the situation is no different in Ghana. We have a national health insurance where people, pay a premium. Some of them, a percentage is deducted from their salaries, those who have formal employment, and it sort of like cuts the cost of medical care. But of course, not everybody in the country has access to that, is covered with that. So there are still a lot of people in Ghana that have to go through what you were describing, that where seeking healthcare is very, very like expensive to them. Even those with the health, some of them can't even afford the premium. So it's still a problem. Like, we still aren't there yet, but at least, some effort has been made. And that is why some of us are doing what we are doing, because we want to play a role in issues like that, because we recognize that it's not just about the patients coming to see you treating them, prescribing. There are certain things that, affect whether or not this patient is going to be able to actually get the treatment that you want them to get, which has probably nothing to do with medicine. Things like finances, for instance, politics. So yeah, that's why some of us are doing what we are doing, so we can play a role in such issues.
Yes, I agree. I'd like to hear that you had a different perspective, because we don't know, because we're not there. But so I guess it's a global, it's very much a global crisis right now, especially because medicine is so high now. And I was reading something about that, like insulin. It costs like maybe $1 or $2 to make, but then they charge it up to $600. It's like, why? Why do we have to be so greedy? Like if it's something that can save people's lives, why are we trying to make a profit? I understand everybody has to get paid, but you're playing with somebody's life here. Like you said, they can't even pay premiums. So it's like, then they won't come to the doctor to get help. So it's just, I know it's bigger than us, but I'm glad that we're starting to see faces that look like us on the forefront, and making legislation and different things, so then we can fight for these issues. And so it kind of goes into our next question, and you kind of were talking about it, so I kind of put the question underneath that. What would you change about your career or your current industry that you're in? So Dr. Lawrencia, you was kind of already saying it, so I'm gonna go ahead to Rudi so you can kind of pinpoint and add on to it as well.
I would say kind of like the perception of pharmacists. Unfortunately, I mean, you're 100% correct. Manufacturers, it doesn't cost much to make a medication, and then it gets upcharged. And so when it comes to us, a lot of people assume that we put the price on it. And it's like, no, I have no control over that. If I did, trust me, I would give you these meds for free. So I would say the perception of pharmacists, because not only that perception of you're charging me $5,000, even though I'm not, it's also, they don't realize that we have a doctorate. Some people come in, they're just like, how long does it take to put 5 pills in a bottle? Like, you went to school, for a year. I'm like, no, like a pharmacist is a doctorate of pharmacy. Like, yeah. It hasn't been a bachelor's degree in over, I want to say 10, 15 years. It's been a doctorate for about 20 something years almost. And so a lot of people come in and they don't necessarily respect their pharmacist, and they assume that the pharmacist doesn't know anything. They automatically assume, oh, my doctor prescribed this, so he knows everything. But at the same time, your pharmacist knows what you've been taking. You might have 5 different doctors. Like, for example, I had a patient today, he has a cardiologist, a nephrologist, and a urologist. So he has 3 different specialties, and they don't know exactly what he's taking specifically for his heart, specifically for his bladder, specifically for his kidneys. And so we mentioned to him, 2 of these medications actually are not good to be taken together. And he was like, how do you know that? And, my pharmacist is like, hey, my doctorate is in pharmacy. Like, my doctorate is to be your drug expert and to explain these things to you and help you, maybe even de-prescribe, because you don't need all that. So he was like, oh, wow, I didn't realize that's what that was. And she's like, yeah, like, I'm literally a drug expert. So I would say the perception of your pharmacist just being a neighborhood person to, like, this is an actual provider, someone that you can come to and you can ask questions. A new movement in pharmacy currently is medication therapy management, which is basically like a brown bag system where, you come in with all the medicines you're taking, and we sit down and we talk to you about all the interactions that may be going on. And, think about it. Our grandmothers have been taking medications maybe for 10, 15 years, and they probably don't even need it anymore, but they're so used to getting a refill.
Yes.
That's what medication therapy management is. It's like, hey, like, do you even still have these symptoms? And some people take medications to counteract other medications. It's like a lot of people don't think that we can actually do more than just verify your medication to make sure you don't die from it. Like, we're someone that you come to, talk to, ask questions. We do vaccinations, like, we do health screenings. So just realizing what a pharmacist is, and I'm guilty of the same thing when I wasn't interested in retail. I was like, oh, that's just boring. And then now that I have my internship, I'm like, wow, there's so much. And so I wish people would understand that it's not, we're not just your drug dealer. You can come to us. So I would like that to be changed, honestly. Yeah.
That is awesome, because when you think about it, and I think about my father, who he passed in 2017, but I would go over to his house and he will have a bag of just medicine.
Yes.
He just start popping open, taking stuff. And I'm like, what are you taking that for? I don't know. They told me to take it.
Yeah.
And it's like, did you take too much? Are you taking enough? Like, where's the accountability? He just has this big old bag of medicine. And it's like,
and it's because
he's stuff that's interactive, like his old stuff that he should have probably stopped taking because you're on a new blood thinner. So you don't need to take I'm taking both. Oh, and so, like you said, people don't really use the pharmacist in that manner. So I like what you're doing about the, the intensiveness of bring everything that you're taking, because some people take stuff and, like you said, it's expired. They don't need it anymore, and they don't understand the drug interaction, and they might be doing more harm than good. So I definitely agree with that. Before we move on, I want to say, guys, thank you for joining. Hopefully we're not still having problems. I saw a little bit of it, the going to streaming in and out. But guys, you can ask questions too. So I know everybody said their highs, but if you have questions or statements, please put them in the comments and I'll make sure I read them to keep everybody up in the breast. So Emmanuel said hello. Hi everybody. Hi. Yes. All right. So we're going to go to the stigma of being a woman of color in STEM. How do you combat that? And so I know I've read both of your articles, which if you have not read their articles, guys, I put the link. You have to read the articles. It's amazing. They go even more in depth into their story. But how do you combat the stigma of being a woman of color in STEM? And both of you by being in medicine, which, just like engineers, some of those fields where we are the minority. And so it's like, how do you combat that and let them know, hey, I am educated, I am here, I know what I'm talking about. What are some of the things you do? So Dr. Lawrencia, I'll start back with you. Lawrencia, I always want to say Lawrencia. Lawrencia, there you go. Hold on, I did block. Hold on, there you go.
That's fine. So like I was saying in the article, so for me, I was born and bred in Ghana. I grew up in Ghana. So I was never really I never felt like I was a minority in terms of like my color. But now that I'm in London, of course, I'm a minority here. I think it all has to do with the mindset, really. Like, before I came, I knew like I was going to be a minority here, but I came with a positive mindset. Okay, I knew I knew what I was capable of doing, and I knew that my work would speak for itself. So I didn't come with any thought of self-doubt, any thought of like, so I just educated myself. I was aware of the barriers I would probably face, and then decided that I would just go in with like that mindset of, achieving what I had set my mind to achieve, irrespective of whatever challenges I face. Okay. In medicine, I think currently in Ghana, we have like, if not a 50, like a 1:1 ratio, probably close to that. Because when I was in medical school, in my class, the girls were actually as many as the boys. So I think that ratio is, is gradually being like, fixed, and it's getting to a 1:1 ratio, which is a good thing. But you find that as we advance in like careers, we go higher, a lot of women tend to drop out, and you see more men pursuing residencies. If you go to like specialist level, you find that there are more men than women, and it's more common in fields like the surgical fields. When you get to consultant level, you find that there are even less women at those levels, and I think that sometimes discourages us as women. We feel like because we don't see a lot of women in such, positions, people like me feel when we see such things, we feel like, oh, then we don't really stand a chance. But I think the key is to actually identify exactly what it is that you want first and foremost, and then have a plan to achieve that, and also to identify like mentors, even though there may not be a lot. If you can identify even one or two that are in a position where you want to get to, and then you just talk to them, have like conversations with them. Sometimes people are afraid to approach people they don't know because they feel they're afraid they will be turned down, you know. They're afraid of the reception they will get. But if even if the person is not nice to you, that's fine. At least you've tried, right? So I think it's really important for us to have like people we can look up to. With the few that you have, you just identify them, ask them, what did you do? How did you get to where you are? And then try to, follow suit and also do more than them. That is how I have been able to get to where I am currently. I became a doctor because, fortunately for me, I had someone in my family who was a doctor. So I looked at what she was doing. I spoke to her. She gave me advice. I followed her advice, and I became a doctor. When I decided I wanted to do public health, I identified people who had done public health and who had attended the school that I wanted to attend, because where I am right now is considered probably the #1 school in Europe for public health. So I wanted to go there, and I was unsure as to like the steps I had to take in order for that dream to be realized. So I spoke to them, and then they guided me. This is what I did. This is what you can do. Blah blah blah. These are the mistakes I made. These are the things you can. So I learned from their mistakes, and then I set out my plan, and today I'm here. So if after this I set another goal that I want to do this, that is exactly what I'm going to do. I'm going to work towards it, but I'll also identify people who are at where I want to get to, and then talk to them and find out how they did it and the mistakes they made and how I can avoid it. So I think
that's awesome. And to your story, like you say, being the best you can be is definitely a way to combat it and not fall into those stereotypes or those traps. But being the best, being knowledgeable, being experienced, looking at those who came up before you and learning from them. So I think that's awesome. Rudi, how do you combat the stigma? Because I know by you being in pharmacy, and like you say, some people might question you, or even at the retail, they're asking you questions. Everybody looking at you like, you know what you're talking about. So how do you deal with that?
I personally, I just keep going. I never give up. So I remember like my grandmother telling me like, if you give up, that's basically telling everyone that you're defeated. Even if someone gives up because they're like, oh, I'm tired. It's like, you may be tired, but to everyone else, it's a defeat. So in order for me to keep going, I just think about everyone I'm setting an example for. Young women of STEM, young women of color going into STEM, even my brothers. I'm like, okay, I'm the oldest. I have to set an example. I have to keep going. It doesn't matter if this person hates me because their drug's $200 and they're screaming at me. I have to keep going. I have to keep a smile on my face and tell them I am so sorry. I really wish there's something I could do. But if I quit, I'm taking a defeat. And then if I take a defeat, that's one less woman of color in STEM, and I mean, that one less person could be the reason why another young lady not goes into STEM. So it's like I just keep going and I think about who I'm affecting other than myself. So I think about my brothers, I think about the little girls, even the little boys, boys of color that want to go into STEM. So I just think about like everyone that I'm like setting a path for. You know, it's like I might like, don't be selfish, kind of, if that makes sense. Like, yes, I might really want to quit one day, but at the same time, I'm just like, okay, there's someone else that might want this spot and thinks that they can't do it or they don't see themselves in that position or in that field. And so my little 5-4 chocolate self can be that little inspiration.
Yes, love it.
About, okay, this sucks. Just turn around, go get an energy drink and get back to it so that someone else can find themselves and, you know, see it, someone that looks like them in that field. So I'd say never giving up is what keeps me going.
Yes, and I tweeted that too, put it at the bottom, and never give up, which is a true, because and it's reality where, like we said, we have to do 110%, sometimes 200% better than our colleague, because as soon as we give up or we look like we've been defeated, I knew she couldn't handle it, or I knew that, you know, you're really paving that way for people that's coming behind you. So it's not like you're doing it just for yourself. And it can get overwhelming because, like you said, we can't have a bad day. We can't come and be off a day because they're like, I knew it. It's like we have to be on. And so we do have to, like, our personal life and our professional life, we have to separate, because if I'm having a bad day and something's going on at home, I can't take that into the, and you're not supposed to take it to the office, but we're human. But when you're a Black woman in these type of roles that you guys are in, and myself, you go in there and you start being off there like, I know, you know, like we don't get that pass. Everybody else can have a pass, but not us. We have to be on. So I'll give you both of you guys on there. So before we talk about your future goals, I just want to talk about your family influence. Your family, how they influence you and how they motivate you every day. So, and I know we talked about this a little bit at the beginning, but I want to give you time to shout out your family members, let them know how they've been inspirational in your lives and your journey. So, Dr. Lawrencia, we're going to start with you, your family influence.
For me, I think my entire family, I come from a very, very wonderful family. I come from a family of 7. My dad is a retired marine engineer. My mom is a retired nurse. Of course, both of them did science-related courses, so probably I was destined to do science. But they were really, like, really supportive right from the start. They never pressured me to do medicine. They allowed me to choose what I wanted to do. Some people are forced to pursue courses that they don't want to do. But for me, it was never that way. I was free to do whatever I wanted to do as long as I had the interest and I had the passion for it. So my parents have been a great influence and a great pillar of support for me throughout my life. They've always been there supporting me, encouraging me. They're like my biggest cheerleaders. The mom and dad, I know you're watching. I know mom is watching because she's commenting.
Right, mom
yeah.
Say hi.
And then I have a wonderful brother who's like my biggest fan. He's also always cheering me on. And then I have 3 sisters. I'm the last of 5 children. So I have 3 elder sisters. And they've also been so, so amazing. And like I said, one of them is also a doctor. The one just before me, she is currently a specialist in anesthesia.
Wow.
Yeah, so she probably did play the biggest influence on me in terms of like pursuing medicine. She is one of my role models, so I'll bet her. She knows that already. She's always like setting the bar high for me, always achieving great things, which puts a lot of pressure on me to also try to at least get close to her level. Yeah, and then my husband too. My husband is also a doctor. I ended up marrying a doctor.
Oh, wow.
Yeah, so he's also been very supportive of me, you know. He encouraged me to pursue this course because he knew that I wanted to do it. And he's been very understanding throughout. So thank you to him as well. Yeah, to my friends, I have amazing friends. I have a very I know some of them are watching. I've seen brides like watching.
Yeah, right. There's been a lot of them. I just can't pronounce
it.
For you, I'm gonna ask a question before when we talk about future goals, because I think it's an awesome question that someone posed. So I think that's great. You also a mom too. You mentioned in an article, maybe not to but you also have.
Oh, yes. Oh,
yeah, come on
how
now.
could I forget? My baby Kemi. Yes, I have a little pug. The most adorable pug in the whole world.
Aw, so cute.
Yeah. So that's Kemi. She's called Kemi. Currently, my husband is the one taking care of it because I'm in London and she's in Ghana. I miss her so much. But
Oh, awesome. All right, Miss Rudi. How about you? What's your family influence?
I would say my family influence is pretty similar to yours. You mentioned that your parents made sure that you pursue anything
Right.
you're interested in. My parents were the same exact way. My parents are not in medicine whatsoever, so they just always I think because they knew that I was into science and stuff, and that was not their things. They made sure all right, make sure this is for sure. How about you test things out? So, I mean, I was really glad that when I went to college, I did pursue and try to, I tried PA, I tried medicine, I tried dentistry, because I found out a lot of things about myself along the way. So them pushing me to look into everything before making a decision choice helped me grow as a person and realize my strengths, my weaknesses. So that was awesome. They're also my biggest supporters as well. They were there. They're there for every single award night and everything. Commented in this this group chat. Hi, mom. I think she's under CL Lee. I think that's her name. I'm here. I can't remember. My brothers are awesome. I'm the oldest of three, so of course I have to set an example, a little bit opposite of you. So I like seeing how you mentioned how they influence you. So that kind of touches me as a big sister, because I'm actually doing something,
Right, you are.
So,
yes.
It's awesome. They're so supportive. My brothers won't tell me to my face that they love me and that they're really inspired by me, but they'll tell my parents, and my parents tell me hey, so and so said that you're doing a great job. I'm like, okay.
Why are boys like that, especially little brothers? Just say it, but the moment you know it and they are telling someone, that's all that matters.
That's all that matters.
They're showing through their actions by following your footsteps. So that's awesome.
Yeah. So they're all awesome. My boyfriend is super, super supportive. He's been there through every single major change. So so it's everyone has always my mom calls me the apple of her eye.
Oh,
so it's really nice seeing her support as a mother, because she's she always has made it a point that she wants her kids to be better than her.
Yeah.
And so, as the first child getting my master's as well as my doctorate, as well as going to secondary education, they're just so insanely proud, and they're always what do you need? What can we help you do? Are you studying? Okay, we won't talk, so they're always good for my mental health, my emotional health,
Yes.
So everyone's just great, and I love them so much. They're my backbone. They were kind of my decision to pursue my doctorate kind of close to home. I went to undergrad about 4 hours away, and that's nothing in their undergrad.
Right.
For doctorate, I was I'm going to need some,
some real support. I need to be close by. I hear you.
So my doctorate's going to be I'm only 45 minutes away, an hour with traffic, but it's something where I'm okay, I need a break. I'm going home.
Yeah.
So they're pretty awesome.
Yeah. And it's one thing I heard between both of you guys, and that's what we try to stress, that family is so important.
Yes.
It's having that support, whether they're inspirational or they're there to help you with your emotional, your mental health, physical, making sure you eat. Because, sometimes we be so busy in our books and at the lab that we forget to eat, and they'll call you that you eat.
Yes.
But I just want to say, for those girls and those women that are out there, if you do not have a family support, a strong family support, find you a mentor, find you an advisor, reach out, because these people can help you. They can stand in the place of your family, because just like I know what you mentioned, sometimes when I got into my higher science and higher math classes in high school, my parents couldn't help me. They didn't know what I was talking about. They couldn't help me with a physics problem. So I had to find me a mentor that can help me solve these problems. And it's not that my family didn't know me. They can only take me so far. So don't be afraid to go out there, look for these mentors, seek mentors out, especially in the field that you're going into. They can help guide you. They can help find you resources where they can help you find you scholarships or fellowships.
Yes.
Reach out there. That's what they're there for. Don't be scared. And if the first person say no, go to the second one. Send them out there till you find somebody that you really care about. Before one of our last questions, someone came up with a good question for you, Dr. Residency. So this is on you. but this is so amazing that I want to share it. It says, congratulations for such an amazing journey in the heart to serve others. Having seen the differences in the public health systems between the first world country, London, and your country, Ghana, how feasible would it be to transfer the skills you have acquired in your practice once your master's is over? So I guess they're saying, what you learned in London, how feasible would it be to bring it back to Ghana to help them since they're not as developed as London?
Oh, yes, that's a very good question. Well, yeah. So, definitely, there are certain things. Having been here for just a few months, I've noticed that in terms of like the healthcare system, there are definitely certain like similarities in terms of like the problems that we face. The problems with funding. Funding is one of the main issues that we have in Ghana, and it's also the same here in London, which causes like overcrowding in certain like at the GP offices, emergencies. So there's like some of the issues actually cut across, but there are certain issues as well that are very like specific to Ghana, definitely. So obviously, whatever solutions that we come up with as we go on, they have to be context specific. There are a lot of things that are done here which are not like directly transferable to Ghana. We have to take into consideration our culture, which is very key. We have to take into consideration people's behaviors, people's attitudes, what really matters to people in Ghana, because it's different. The culture here is totally different from the culture back at home. So there are certain things that will work here that will definitely not work in Ghana. But I think fundamentally, like the fundamentals are pretty similar. So some of them, yeah. So like just to answer the question, like some of them may work in Ghana, but some of them we definitely have to take into consideration, certain specific things that are, key to our Ghanaian culture and our Ghanaian setting.
Yeah, and I think the second question that you kind of answered it. They said, "Do you anticipate any challenges to implement your vision?" And you did talk about the challenges with just the culture itself and making sure that what you bring back is feasible for your culture and what you guys have. Because you can have all these bright ideas, but the application is which is going to be key. So,
yeah, definitely.
All right, guys. So we're coming to our last question. And it's about, even though it's your future, and I was kind of combining these two, it's your future goals and giving back. So when I talk to you, I want you to say, like, what's your future goals and how you plan on giving back? And just doing this, you guys don't understand. Just doing this interview right now, you're giving back because this is going to be on our YouTube channel. We're going to post it constantly, and people are going to hear your story and get inspired. And you guys have brought a lot of people on to view. Like I did see your mom, Rudi, CLE. Hey, Mom. Like you are inspiring others. And even if they're not watching now, we're going to share this and you guys are going to share it out. So this is a way of giving back as well. But Rudi, I'll start with you. What are your future goals? And what is your plans of giving back?
So far, I always say this to people. They're like, what do you want to do right now? And so right now on today, I kind of see my goal as possibly doing my residency in either oncology pharmacy or transplant pharmacy. Those are two of my top specialties I would probably go into, mainly because of like the long-term relationships I build with people, especially with transplant, being able to be with them before transplantation, during transplantation, and after, and educating them about the importance of, transplant rejection if you don't take your drugs. Same thing with oncology, just making sure they're good and, making sure the chemos work and, nausea medications because chemo makes you nauseous, stuff like that. So those are my top two goals that I see myself in right now. Obviously that can change. Maybe in 4 years, I decide I want to do like infectious diseases. So that's where I see myself today right now. But in giving back, I kind of think of it in terms of kind of like what I'm doing now. I started my blog and my Instagram page specifically about pharmacy in my personal journey. So I see that as a route to me potentially giving back, because maybe down the road, I've inspired a lot of women to go into pharmacy, maybe even to go into public health, since that's what I'm also getting my degree in, and just helping students along the way, students that don't have someone to reach out to and ask, how do you write a personal statement? How do I get a letter of recommendation? How did you do this? Who did you shadow? So that's kind of my main priority with giving back, is just bringing more people in, helping students along the way, guiding them. Because I didn't have that when I applied to pharmacy school.
Exactly.
I mentioned that my parents are not in medicine whatsoever. So a lot of the things I learned along the way, I learned from Google. I learned from Google. I learned from Instagram, mainly pre-med Instagram pages, because there's not many pre-pharmacy pages. So when I created my blog, I was like, yes, this is specifically for pre-pharms, but anyone can take this information, because maybe there's someone that's, pre-occupational therapy, and they don't have that information on how to write a personal statement, how to, navigate through the application systems. So I really want to guide students and just educate people along the way, as well as obviously, like, I love, volunteering. So I see myself continuing to volunteer locally through school and afterwards. So that's why I think I'm going to do that.
Amazing. And I just want to say, you don't realize how important, when you talked about the transportation medicine, because my mom 5 years ago, thank the Lord, knocking on wood and everything else, she had a heart and kidney transplant.
Mm-hmm.
And so I remember the pharmacist coming in and say, hey, this is what you're on now. This is what you're going to be on. And then after she had it coming, sitting at her bedside. Then when we got home, I had to put all her little pills in the container and make sure that, and it's so important because we didn't want her to have no rejection. And definitely because we didn't give her the right medicine, or she wasn't taking the right medicine. And even to this day, Mom, you take your medicine, we're out, she's like, I got to take my medicine. Like, yes. So that is so important. Yes. The people that's oncology that has cancer, medication.
Yes.
That's the key to life. I know, better diet and all of that, but truth be told, if there's medication that needed to sustain life, we have to make sure that they get it and they're taking it properly. And that's the thing with her. I have to make sure, and she's been on it because I don't even live there anymore. And she's been on it, and she has her little stuff. She was a lot better than my dad. I told you, my dad had this plastic baggie with all this medicine. I'm like, oh God, what am I gonna do with you?
Yes.
Mom has the little, Monday this, Tuesday this, morning, middle, afternoon, her little baby vitamins, everything. So what you're doing is so important. And with your blog, I think, did you put in your article the link to your blog, or like how they can look your blog?
I did.
Yeah, yes. So guys, you can keep following Rudi, who will be soon Dr. Rudi, as she pursue her PharmD. Make sure you guys check out her article. She's amazing. We're not getting rid of it yet. I just want people to know that they need to follow you, check your blog out and everything, because it does help about, and especially if someone's going into pharmacy or interested into. Like I said, reach out to these people. That's why I provide you their emails, everything, so people can reach out to you guys. So if they have questions, they can contact you and, keep the conversation going. All right, Dr. Lawrencia, your future goals, which we know a little bit of them, and how you plan on giving back.
Well, so after my master's degree, I'll probably go back to Ghana and continue with my clinical work, because I don't know if I can ever lead clinical work. I just love seeing patients, taking care of patients. So I think I'll probably still continue doing my clinical work, but this time I'll be able to do more, because now I have like research skills. So whilst I'm doing my clinical work, I can also conduct research. I can get involved in playing a bigger role in improving on the Ghanaian health system. So I plan on like working with institutions that aim at improving health systems, like the Ministry of Health, the Ghana Health Service. So yeah, and I also, one of my career goals is also to lecture. Probably public health. I'll probably do that at some point in my life as well, so that I can guide students, in critical thinking, particularly in Ghana, and research as well. So yeah, that's what I have planned as of now. Those are like just broad goals. I don't really have like specific things, but those are the broad things that I want to do. But as time goes on, I'm sure I'll probably figure out, more specific ways of doing that.
Yeah. And just what you're doing now, you're so interested in, helping public health. I know there's going to be, some ways that you're going to be involved, and just what you're doing now, being a general practitioner, making sure that you give back to your community. I think that you're doing this awesome and amazing as well. So like I said, my audience, or our audience, if you have not checked out their articles, I provided the link. Please go on the website and leave comments. Encourage these ladies. Leave comments on the website. Let them know how well you respect their journey and how it inspired you. We've had some comments. I want to read them before we go. There's a whole bunch of so proud of you guys. Great job. Queen settings. Keep queening, ladies. You both are amazing and doing great, Rudi and Lawrencia.
Oh,
Medicine are live. And I swear I can't pronounce his name, but Don Moore, he said, thumbs up to you too. You're doing great. So it's just wonderful to hear people say that and support. And I just want to say, guys, thank you for taking the time out to fill out the article. Thank you for, letting me share your journeys, because I truly believe we are giving back and we're going to touch lives just in our story. We got, I think it's a Tiba from Nelson, Love from Trinidad. So we're going global, guys, and I love it. And I am just so happy that you guys could be a part of this. And so I don't want to continue to keep us any longer, but I just want everyone to know that Nyla Danae Enterprises is here. We want to continue. So if there's anyone else that you feel would be a good STEMsation, please tag them. Please share them. Share their information. Let them know they can get in touch with us. We want to keep this going every Sunday, where we have 2 wonderful STEMsations, trailblazers that are doing their thing, because they are doing awesome. Yes. So, ladies, is there anything else you would like to say before we have to go?
Just thank you for this opportunity. This was awesome. You guys are just awesome.
I know, and it's just like you guys inspire me. Like I said, I was going for engineering, and I'm a teacher. Now, sometimes I'd be like, I'm just a teacher, but I feel that just having this platform is going to inspire those that want to go into engineering, pharmacy, and those things. And so I feel that I'm still giving back as well. And so I just want to thank you guys. I want to thank our viewers. I also put the link down for the STEMsational bundle. STEMsational bundle, please help us continue our mission by helping getting this into people's and girls' hands so they can see themselves and see how powerful they are. So Nyla Nova, who's Nyla Nova? Yes. So you can find that on the website as well. We want everyone to have a STEMsational week.
Yes. And thank you again, Nikisha. And thank you everyone for showing up. I see you all. Thank you.
Guys. We see you. We love the hearts and the thumbs up, and please continue to share this out on your pages as well. We want to keep this going. I love you guys. Thank you for being here. And I just want to end with just tell everyone once again, have a STEMsational week and keep shining. Don't let anyone dim your lights. Guys, we're out there and we are no longer hidden figures. We are up front and ready to do the work that's needed to be done. So thank you guys. We're going to sign off, but thank you.
Thank you.
Bye-bye. You stay on. You don't hang up yet. Because they always hang up and I'll still be trying to talk to them. But thank you guys. Thumbs up. Bright says, love you guys. Thumbs up. Thank you. I just got to give everybody a hug. I feel all the love on this line. Guys. Bye-bye.
Bye.